Hi, good morning. I'm here this morning at the field house with Dr. Andrew Kirkpatrick. Now, he is an orthopedic surgeon who is fellowship trained in the hand at Aurora BayCare. Welcome to the field house this morning, doctor.
Thank you.
So this morning we want to talk about wrist injuries. So explain some of the most common injuries that people experience and how they affect your everyday life.
Absolutely. Yeah, we see a wide variety of wrist injuries and conditions, as you might imagine, and they range anywhere from very, very serious injuries like fractures and dislocations, the most common ones being a broken bone in the wrist called the distal radius, to other conditions that are more degenerative like arthritis and tendonitis from overuse type situations.
Sure. So how can people at home prevent these injuries from happening, or even, kind of stop them, not make them worse?
Right. Yeah, there's a lot of things people can do to prevent wrist injuries. We call it activity modification, but it's nothing really complicated, just basically being aware of your surroundings, using common sense, things like not riding your bicycle or motorcycle when there's slippery road conditions. You can reduce the speed and force of repetitive movements if possible. For some people, it's part of their job and they're not able to do that. Taking precautions to prevent falls, which is particularly important for our older population.
Sure.
Things like being aware of the surface you're walking on, to using grab bars and walking rails, and then using the proper equipment if you are participating in a sporting event.
Sure. And so when should people see someone like yourself?
Yeah, certainly if there's a significant injury with significant pain or swelling, any type of deformity, or somebody can't move part of their hand or wrist, that's an indication to come see us right away. And then for the more chronic things, if you have severe pain or swelling that lasts more than 24 hours, particularly with like tingling or numbness, that's an indication to come see us too.
Wonderful. Well, thank you for joining me this morning, doctor.
Thank you.
If you have any questions about Aurora's specialized orthopedics teams, you can visit aurorabaycare.com/ortho. Good day, Wisconsin. We'll be right back.